A standoff between the Council of Governors and the national government over the implementation of the equalization fund threatens to derail the expansion of medical facilities in county governments. 84 medical facilities across 12 counties remain unoccupied despite majority of them being completed due to a payment dispute, while some of the facilities that could be used as isolation and quarantine centers in the counties in the battle against the virus.
Government bureaucracy and bottlenecks may well be standing in the way of equipping counties' health facilities, with the Health Ministry directing county commissioners and boarding school head teachers to scout for an additional 1,000-bed capacity facilities in counties as they become the next battle frontier in the coronavirus pandemic.
We have asked the county commissioners, the head teachers of the schools involved in boarding facilities. We have asked those involved in the preparation of food in those boarding facilities to start planning. We would like to see, depending on the population of the county, an additional 1,000 bed capacity as quarantine facilities in boarding schools and in hospitals. 84 medical facilities across different marginalized counties lie idle after completion, with some stalling just near completion. The facilities scattered across remote areas of Narok, Kwale, Turkana, Wajir, Marsabit and Lamu counties, among others. At the center of the dispute is the management of the equalization fund, pitting county governments and the national government, both claiming a stake in managing the kitty. The project, then undertaken by the national government through the Health Ministry, was overturned by High Court ruling in November of 2019. The Council of Governors had sued Treasury for undertaking payments for projects ideally under marginalized counties. The High Court ruled that the equalization fund can only be disbursed by the national government through the respective and affected county governments and not line ministries. This rendering the medical facilities projects procured null and void. Given that the Health Ministry had already entered into contracts with various contractors across the country, a pay dispute has emerged, with the facilities remaining empty shells that are yet to be handed over to the respective counties. County governments are adamant that they are supposed to run their programs. To unlock the stalemate, Health Cabinet Secretary Mutahi Kagwe has written to the Council of Governors Chairman Wycliffe Oparanya, seeking a consensus to have the matter settled out of court. The Health Ministry also wants to strike an agreement with the Council of Governors on modalities of handing over the already completed facilities for use in battling coronavirus pandemic. With the dispute running since 2017, the Health Ministry has withheld a budget of 1.964 billion shillings, usually rolled over to the next financial year for development projects, urging counties to allow Treasury to have the contested budgets uploaded on the IFMI system to allow for payments of contractors and as well allow contractors complete their pending projects. Majority of the contractors complaining of pending bills running back several years and completed projects that have no one ready to take them over. The dispute happening at the expense of equipping what will be much needed additional health facilities in readiness for the battle against coronavirus. Samogina, Citizen TV, Nairobi.